Hello everyone. Now this video is about the interview prep that I've been offering people, so I just want to clarify exactly what I mean and what it is that I'm offering, because I get messages about this, or I have been over the last couple of days, and I figured that it would just be easy to clarify these points for everyone. Now, first things first, what I'm actually offering is a mock interview in either MMI or panel style, depending on what exactly it is you want. And we can obviously arrange to have a mix of both, or multiple sessions, or whatever is easiest for you guys. People have also been asking how much they cost. I've never mentioned money at any point. They're completely free. I have a couple of weeks off. I have 3 weeks off, in fact, and I'm not really doing anything. So it seems like a good use of the time for me to at least help some of you guys that enjoy the content with your own applications. Now, big disclaimer, I am obviously not an expert by any means on medical applications, and I don't pretend that that's the case. What I found most useful when I was applying was just having people fire questions that I hadn't heard before at me and forcing me to answer them under time pressure. And that's what I think you need to get used to. And that is essentially what I'm offering you. I can set up kind of mock MMI mini stations that we can do one-on-one and ask you themed questions, or equally we can do it over a longer period as in a panel interview. You know, I'm a first year medical student. I got one interview which I successfully got through. That's my track record, but I found it useful when I was applying, so I just figured it would be useful to offer the same thing. And the next big thing to talk about, and people have asked directly about this, and as with so many things in life, it's completely my own fault, but people have been asking for Warwick specific advice for the Warwick format. I am absolutely not going to talk about the Warwick format specifically, for a few reasons. I don't want to run afoul of the uni. It wouldn't be fair to do that, because obviously that would give people a massive amount of insider information that would completely skew the process. And in general, this channel is just about accessibility. I want everyone to have as fair a playing ground as possible. The questions and the advice that I would ask you in a practice interview are questions that I've either seen elsewhere or devised myself. To prepare for mine, I basically devised a load of questions, you know, close to 100. They're actually on my website, you can go and read them. And I wrote out responses for all of them. I thought about every single one and went through them for hours and hours and hours, thinking about it. So I did just want to clarify that. I hope that makes a bit more sense. So big things, they're free. Secondly, I don't really know what I'm talking about, but I found this sort of method of learning useful when I was thinking about applying and when I was preparing for interviews. Thirdly, no Warwick specific advice. As I've said before, it's generic advice, but I hope that that helps and that it will help you feel comfortable in applying to a wide range of universities, which is obviously what everyone probably does anyway. So thank you so much guys for engaging. Engagement with the concept of the practice interviews has been so good. I've had like 12 responses since yesterday. And actually it's just gone midnight, so the first couple of these practice interviews I'm actually going to be doing later today in about 12 hours. So once more, if you'd like to... Sorry, I just coughed really hard. So just a reminder, if you would like to book a practice interview slot with me over Skype over the next few weeks, just let me know through comments or find me on Twitter, or use the contact form on my website, PostGradMedic.com. We'll book a slot, we'll find out when's good for you, and I'll work around you as best I can. We'll have it, I'll provide you some feedback, and then when they're all done, I will start compiling a generic feedback document, because that's probably going to be useful as well. I just want to get as much useful information for you guys out there as possible. So take care, book an interview if you want one, and I look forward to speaking to some of you. Bye.